Hello and welcome back to Venom Therapy for Lyme Disease, Part 2, Stinging. I do hope that everyone got a chance to look at the first video and you have all of your supplies ready and you are ready to start stinging. So that's what we're going to cover this evening. Every time that you sting, make sure you get your EpiPen out, know how to use it, make sure you're familiar, you've read the directions, you have it out and ready to go just in case. If you're doing this by yourself, have a cell phone available in case you have to call 911 for emergency. God forbid, just be safe. Have your Benadryl ready in case you have any kind of nervousness or anything going on. You can calm yourself down with that. You can use an ice pack. If you choose to ice the area first, which my dear friend who's been so kind and gracious to let me, to help me do this video this evening for you, she doesn't ice because she's really tough. But some people prefer to ice, and it's okay. If you need to ice the area down to help relieve some of the burning of the sting, please do that. There's no right or wrong with this ice, no ice. Either or is just fine. So if you need to ice, please do that. So you have your ice pack. We have our tweezers ready. We have our container with soapy water ready to bless the bee and say goodbye to them. We have our squirt bottle in case one gets away. And we have the bees in the visa hut. I'll show you how the bees are right there, ready to have their debut. So we're going to get right in there and we're going to start doing some stings. The first thing you're going to do is you're going to do your testing. My friend's already up to 10, so we're going to just sting her. But a testing would consist of one bee, one sting, leave it in, count to 30, pull it out, wait 15 minutes, make sure everything's fine. If you feel your throat, your sinuses start to close, really close, you're having anaphylactic shock. Use your Benadryl, use your EpiPen, get to the hospital for help. A little bit of itchy, a little bit of tightness, that could be Lyme. So unless your throat is truly closing up and you can't breathe, anything other than that, you're fine. There's no delayed reactions to anaphylaxis. You either have it or you don't. So you're testing. You're going to get one bee. You're going to get in your hut. These girls are very, very active because they're brand new. You're going to get in your hut and you're going to get one bee. I use my straight tweezers because I can get them by a leg. I'm going to get a little looser ones. I can get them by a leg or wing, so I'm not trying to torture getting them by the head and inside the box. And don't be hard on yourself. It takes practice to learn how to catch bees. It takes practice to learn how to catch a bee. So don't be hard on yourself. We take the bent tweezers to have the bee by her wing. We take the bent tweezers and you're going to secure the bee by her. Have your bee. You want to position your bee so that her little stinger is up here. So when you place it on the skin, she'll sting right away. If not, you can tap her on the tush. Okay, we sting along the spine, 1 inch either side of the spine. So you're going to find the spine, right? Find the spine, and you're going to go 1 inch either side of the spine. Now for a test sting, I prefer to do it here between the shoulder blades. Right or left side is fine, either or. Okay, you ready? I'm going to give you your first one. She's such a trooper. She does this. She's been doing it for a while now. So you find the spine. You're going to take the bee and go 1 inch outside of the spine. And you're going to tap it on its tush if you need to. Remove the bee. The stinger stays in with the venom sac. Leave it in 30 seconds. Remove it. Wait 15 minutes. And see how you're feeling. If you're going to have anaphylaxis, it's going to happen pretty quick. It will happen really quick. So for new people, that's your sting. That one. Wait 2 days later. If you feel like you can do two, do two. A lot of people herpes from the testing. So depending on your bacterial load and how you're feeling, you might want to just do the testing first. Wait 2 days. Do one more sting or go up to 2. That's up to you. We want to ramp up our stings according to how we're feeling. as far as our detoxing and our herxing. So what we're going to do is we divide the back into 2 sections. With big tall guys, I divide them into 3. But most people will use the bra line as the line of demarcation, or guys, you can use the middle drift here in the ribs. Monday, Wednesday, Friday. We do 3 days a week, Monday, Wednesday, Friday, or you can choose Tuesday, Thursday, Saturday. As long as you're doing every other day and taking 2 days off. That's up to you. Most people prefer to sting in the morning because it can give you a lot of energy. So if you sting at night, it might keep you up all night. So be mindful, try either or what fits in your schedule, but it might keep you up all night if you choose to sting at night. So just be mindful of that. So we're going to go ahead and sting her. She's up to 10. So we're going to go ahead and give her 10 stings. But what you would do is new people, when you're ramping up, you would do one more on the opposite side of where this test sting was. And then the following 2 days later, you're going to do 2 below, 1 or 2 below. Keep it 1 inch left and right of the spine. Do a Monday, Wednesday, Friday, Monday, until you're up to 2 and 2, 4 and 4. You can go up by 1, you can go up by 2. That's up to you and how well you're handling this, how well you're detoxing out. Be mindful, pay very good attention. Keep your journals, write a journal every single day, how you feel, how many stings you did, what you're doing for detoxing. Keep a journal, it's imperative. This bee venom therapy for Lyme disease is a crazy roller coaster ride. The first year, you are going to experience so much. You're going to be up and down and up and down and up and down. You're going to hurt, you're going to have headaches, you're going to this. Whatever infections you have, you're going to get the symptoms. Bee venom is bringing everything in your body that you're carrying acute. And it doesn't matter if it's Epstein-Barr virus or herpes, and the Lyme, and Bart, and Babesia, and whatever else it is that you might be carrying, or Lichiosis, Rocky Mountain Spotted Fever. You will get the symptoms of these things. They may not be they're most likely, they're not as strong as your initial infection. So don't fret about that, really. Most of those are actually pretty mild, but you will get the symptoms. Rocky Mountain Spotted Fever, you'll get spots on your hands and your feet. Ehrlichiosis, you'll get bad digestive. Fevers, chills. All these things are possible in the first year of bee venom therapy, as it brings it acute and it kills it. So guys, if you want to separate yourself out into 3, upper, middle, lower. We're going to stay from here. You can look on the spine chart. We want to stay from just above the shoulder blades to just below the waist right here for the first 5 months. Because we don't want to, if you go up higher on the neck, it's going to produce a serious mental herx, neurological herx. If you go lower here, it's a very sensitive area. It hurts like crazy. So give yourself some time. As you're ramping up your stings, your body is getting used to breaking down the venom, and it's getting used to using the venom and adjusting. So give your body time. Be kind to your body through this process. That's all I ask. Be kind to yourself. Less is more. Don't overload your body with a bunch of herbs and tinctures and stuff that are not going to help your progress with this. Keep it simple. Get your supplies. Make sure you have your detox plan in place. Okay, so now we're going to go ahead and do the rest of these things. You ready? Here we go. So we're going to get the bees. I'm actually going to get several bees. I'm running out of bench teasers because I keep giving them all away. So a lot of people like to go ahead and just collect all their bees. You can do one bee at a time. If you're ramping up slow, see she's a little rambunctious, so we're going to give her a little squirt, little water squirt here. And I'm going to take her like this. Here we go. You can do one sting at a time. If the sting hurts, tap. Tap around that sting like this. Husbands, tap your wives. Wives, tap your husbands, etc., etc. Friends, tap your friends. This helps interrupt the nerves when you first sting. Do it for just a couple minutes. It takes some of that pain away. It's very helpful. Unless you've iced, you probably won't feel anything. If you've iced it up, you won't feel much. Don't worry about it taking you a while to catch your first few bees. This takes time. It takes practice. So don't worry if it takes you 10 minutes to catch your first bee. This, you know, in a month, you'll all be catching ninjas. I promise you. And bees are quick, so you have to get in there and just get them. So I like to catch several of them and just line them up and have them ready to go. So we can just get all this stinging over with pretty quick. Uh-oh, see, a bee got out. We're going to let her go. Let her go to the light. And we'll find her later. Here she is. She's just lying around. She's having herself a good time. She's enjoying herself. Don't panic. Don't give off the fear hormone, the fear pheromones and all that. No. Now I got another one. Now we have two on the loose, and you know what? It's okay. They'll go to the light. They'll land on the light. We'll collect them afterwards. See, she's right here on this, she's right there on the, so just gather your bees. So I've got 2, 4, 5, and we've got 1 in there, 6, 7, 6, 7. Don't worry about the bees flying around. You can get them. You can get them after. We can actually. I'll get them by their little foot, and I'll put them back in the crate with their sisters, so they'll be fine. They're fine. Okay. Now, when we do sting. Okay, ready? Here we go. 1 inch either side of the spine. I hope you guys can see. She's having a very nice reaction. Her immune system's working really good. It has woken up. You'll get a dime-size wheel. Sometimes the wheels will get legs coming out of them. When they get legs coming out of them, it's chasing a virus. It's getting things out of your epidermis. This is a good sign. Sometimes if it's chasing a virus, you'll actually see a rash come all the way around the nerve stem. This is a very good sign. It means the next day you're going to feel not so great because you're going to have flu-like symptoms. Not going to be feeling so great. So here we go. Are you ready? Here we go. She's been so patient. Okay, she's not wanting to sting. I think I kind of smashed her. So we're going to let her go and we'll go for another one. And there we go. After you sting, give a little tap. It's okay. However many you're up to, you know, take your time. Most people can get up to 10 stings in 3 to 4 months. That's a very good goal to have. If you're in a really rough way and you need to take a little bit longer, don't worry about it. Take a little bit longer. If things start backing up on you and toxins are backing up on you and you have to take a day break, then do that. Give your body an extra day to detox out. You'll be fine. This is fine. This is very simple. By the time you get this down, we're going to do 1 inch outside, either side of the spine. We want to put 1 inch in between the stings. So we're going to go here. And then we bless the bee. Thank you, sweet girl. Thank you for giving us life. Stop the light. Bless the bee. into the sudsy water. They'll asphyxiate right away. And ready? Okay. And that's 5. I like to do them all at once and get it over with because you're going to feel the pain for 60 to 90 seconds. You might as well feel it and get it over with. Sometimes the bees drop a little bit of bee caca on you. It's okay. It's good luck. You just sop it up with a paper towel. 6. Here we go. We got 2, 4, 6, 7. Bless the bee. I'm going to reposition her a little better. They're stinging. And this is not a race, you guys. You know, just take your time. As you start to ramp up, you'll get more familiar and more familiar with catching the bee. I kind of do need those 2 that are running around up there having themselves a ball. Take your time. Be patient with yourself. Bees are fast. Bees are fast. They move around pretty quick, so just be patient. No, I was not this fast at catching bees in the beginning. I was terrified to catch a bee. I did not do well. It took me quite a while to get used to doing this. Okay, and here we go, last 2. Thank you, baby. Bless you, sweet girls. And now you'll actually see this venom sac is pumping like crazy. If you have your glasses on or a magnifying glass, you can see that venom sac just pumping and pumping and pumping. Now, you're going to leave them in 15 minutes. You can leave them in 20. It doesn't matter. By 15 minutes, we know we have all the venom. Even after 20 minutes, you could pull one of these stingers and it'd still have a tiny bit of venom in it. So, you know, in 15 to 20 minutes, you've gotten all your venom, enough to treat you. You're going to be fine. Leave them in 15 minutes, and then we pull them out. When you go to pull these out, you're going to take your bent tweezers or straight, either one. You want to make sure you grab it and you take it out sideways. These need to come out sideways. Put them on, get a paper towel or a tissue, because you can see the stinger and the sac and everything when you pull it out and you put it on the tissue. That way you make sure you have the stinger out too, not just the venom sac, because we don't want stingers left in the body because they'll fester, they can pus over, it's gross. So want to make sure we get them all out. It's very simple. I've never had one stuck that I don't go back and get, and it's fine. So leave them in 15 minutes. So what we'll do is the day after tomorrow, we'll go down to this section and we'll divide them up 10 in here. And then the following 2 days later, we'll divide them up between here and go in between the other stings. We got to give them time to heal. Monday, Wednesday, Friday, Monday, Wednesday, Friday. It's allowing the other ones time to heal. Go in between the last ones that you did. Don't sting on one that's still red. That's still red and still inflamed. So just alternate your stings. You'll be fine. This is very simple, very easy. By the time you get the hang of it, you're going to have this whole thing done within a half an hour, 3 times a week, and that's it. It's so easy. So thank you so much for joining me. Be very good bee parents. Take very good care of your bees. Take good care of each other. Please watch the first video. Have all your supplies ready before you start this. I wish you all lots of blessings on your healing journey. It's not an easy one, but it's absolutely worth it. God bless.